Think about the last time you saw your doctor. You waited longer than your appointment was supposed to take. You got maybe 10 minutes with the physician. You left with a prescription you weren't sure you needed, and a bill that didn't make sense. You probably told yourself that's just how healthcare works now. It didn't always work this way, and it doesn't work this way by accident. Over the past decade, private equity firms have quietly purchased over 30% of all medical practices in the United States. Your family doctor, your dentist, your therapist, your dermatologist, your emergency room, bought by Wall Street, without your knowledge, without your consent. And when Wall Street buys something, it doesn't buy it to make it better. It buys it to make it profitable. This is the story of what happened to American healthcare when it became a financial product, and why your life may literally depend on understanding it. To understand how this happened, you need to understand how private equity works. A private equity firm raises money from wealthy investors, pension funds, university endowments, sovereign wealth funds. They use that money to buy companies, load them with debt, cut costs aggressively, extract maximum value, and sell them within 5 to 7 years for a profit. It works in retail, it works in media, it worked in housing, and starting around 2010, private equity discovered healthcare. Between 2010 and 2023, private equity completed over 8,000 acquisitions in the healthcare sector. Physician practices, hospitals, nursing homes, hospice care, behavioral health clinics, dental chains, dermatology groups, emergency medicine staffing firms. By 2023, private equity-backed firms employed or contracted with an estimated 1 in 10 American physicians. And the doctors themselves, many of them, didn't fully understand what was happening until it was too late. Here is what private equity ownership actually looks like inside a medical practice. Appointment times get shorter. The industry standard for a primary care visit has shrunk from an average of 20 minutes to as little as 7 in many private equity-owned practices. 7 minutes to discuss your health, your symptoms, your concerns, your life. Unnecessary procedures increase. Multiple studies, including research published in the Journal of the American Medical Association, have found that private equity-owned practices perform significantly more high-revenue procedures than their independent counterparts. Not because patients need them more, because the procedures generate more billing. Doctors who don't hit revenue targets face consequences. Some are given explicit quotas, a certain number of procedures per week, a certain billing amount per month. Physicians who refuse to meet targets have been demoted, had their hours cut, or been let go entirely. One emergency medicine physician described it this way, and I want you to hear this clearly. She said that after her practice was acquired, she began receiving weekly emails detailing her revenue per patient hour. Not her patient outcomes, not her diagnostic accuracy, her revenue per patient hour. The metric by which she was being evaluated as a doctor was how much money she generated per minute she spent with a patient. She quit within a year. Many others have done the same. Between 2019 and 2023, physician burnout rates hit record highs. The number one reason cited in survey after survey was not the difficulty of medicine. It was the loss of clinical autonomy, the feeling that financial considerations were overriding medical judgment. But what private equity did to the exam room is only half the story. What they did to the billing department is where it gets truly criminal. A practice known as surprise billing became epidemic in private equity-owned emergency medicine and anesthesiology groups. Patients would go to an in-network hospital for surgery, only to receive a bill weeks later from an out-of-network anesthesiologist they never chose and never met, employed by a private equity firm that had specifically structured its contracts to remain outside insurance networks. The bills were catastrophic, tens of thousands of dollars, for a service the patient had no ability to consent to or decline. A 2020 investigation found that one private equity-backed anesthesiology group had sent bills averaging over $7,000 to patients for procedures covered by insurance. then pursued those patients aggressively through collections when they couldn't pay. The No Surprises Act, passed in 2021, was supposed to end this practice. Private equity firms spent millions lobbying against it. When it passed, they immediately filed lawsuits to weaken its provisions. Some of those lawsuits succeeded. The surprise bills kept coming, and here is perhaps the most devastating number in this entire story. Medical debt is now the leading cause of personal bankruptcy in the United States. Not gambling, not bad investments, not irresponsible spending, getting sick. Between 2019 and 2023, physician burnout rates hit record highs. The number one reason cited in survey after survey was not the difficulty of medicine. It was the loss of clinical autonomy, the feeling that financial considerations were overriding medical judgment. If what happened in physician practices and emergency rooms makes you angry, what happened in nursing homes should make you something beyond anger. Private equity acquired hundreds of nursing homes across the United States throughout the 2000s. The playbook was identical. Buy the facility, cut staffing costs, extract management fees, load with debt. But in nursing homes, cutting costs doesn't mean slower service or shorter appointments. It means fewer nurses per patient. It means reduced medication budgets. It means deferred maintenance on safety equipment. It means the most vulnerable people in our society, the elderly, the disabled, the dying, cared for by an increasingly stretched and underpaid workforce in facilities whose owners were primarily focused on their return on investment. A landmark study published in the British Medical Journal in 2021 examined over 18,000 nursing home residents across hundreds of facilities. Its conclusion was unambiguous. Private equity ownership of nursing homes was associated with a 10% increase in short-term mortality among residents, a 10% increase in deaths among the elderly, among the sick, among the people who had no ability to choose their facility, no ability to leave, and no ability to advocate for themselves. The owners of those facilities, the private equity partners who approved the staffing cuts and the debt loads and the management fee extractions, faced no criminal charges. Most of them made money. Medical debt is now the leading cause of personal bankruptcy in the United States. Not gambling, not bad investments, not irresponsible spending. Getting sick. Between 2019 and 2023, physician burnout rates hit record highs. The number one reason cited in survey after survey was not the difficulty of medicine. It was the loss of clinical autonomy, the feeling that financial considerations were overriding medical judgment. How did this happen without anyone stopping it? The answer is the same answer we find at the end of every dark vault story. The people with the power to stop it were also the people with something to gain from letting it continue. Private equity firms are not required to report their healthcare acquisitions to any federal regulatory body. Between 2010 and 2020, the FTC challenged fewer than 5% of private equity healthcare acquisitions. The other 95% went through with no regulatory review whatsoever. Meanwhile, the healthcare and private equity industries collectively spent over $700 million lobbying Congress between 2010 and 2023. The system that was supposed to protect patients was being systematically purchased. In 2023, a bipartisan group of senators introduced the Health Over Wealth Act, legislation that would have imposed significant restrictions on private equity ownership of healthcare facilities. It never came to a vote. The acquisitions continued, the bills kept coming, and in nursing homes, in emergency rooms, in the exam rooms of practices that used to be owned by the doctors who worked in them, the financial models kept running. Here is what this story is really about. Healthcare is not like other industries. When a private equity firm destroys a retail chain, people lose jobs and communities lose stores. That is a tragedy. But people find other stores. When a private equity firm extracts value from a hospital, people die. When a private equity firm cuts staffing at a nursing home, the elderly suffer alone. When a private equity firm optimizes an emergency room for revenue, the person having a heart attack in the waiting room is not a customer to be served. They are a revenue opportunity to be processed. There is a word for a system that takes money from sick people and gives it to investors. We just don't say it out loud very often. Every story the Dark Vault has told connects to this one. The housing crisis, the grocery bills, the student debt, the financial frauds. They are all symptoms of the same disease. A system that has decided that human beings are most valuable as sources of revenue. Your home, your food, your doctor, your retirement. All of it, quietly, systematically converted into someone else's return on investment. The question isn't whether you can afford healthcare anymore. The question is whether the people making decisions about your healthcare can afford to care about you. Right now, in too many places, the answer is no. Your doctor didn't change. Their owner did. The Dark Vault opens every Thursday. Subscribe, because the next story is closer to home than you think.